From the News Channel 5 Network, this is Openline.
And we are back on Open Line with special guest Dr. Richard Horwat. Tonight is Ask the Expert. We are asking the endodontist. He's got some great answers, and we appreciate all the calls. And one of the things that, and just doing some research, the average endodontist completes 25 root canal treatments a week, while general dentists do about 2 root canals a week. So
25 a week.
25 a week, okay. 2 a week. So how does that kind of figure into your?
Well, you know, if we're doing that many more root canals, obviously.
All right, going right back to the lines right now. So we're going to talk with Sandy. Sandy, we appreciate your patience. And do you have a question or a comment?
I have a question.
Sure.
Okay. My dentist of like 30 years ago told me I had periodontitis and gingivitis, and I would lose one tooth at a time, which is true. And he passed away, and I got another dentist, which is excellent, and I've had him 20 years, and I just keep, you know, spending tons of money on tooth after tooth, and I keep losing them, and he said he would never pull all my teeth, but now they're starting to loose up and trying to fall out. I could actually pull them myself, and, you know, I'd just like to know, what do you suggest?
You know, I think it's a very, very unfortunate situation. I've seen a countless number of those things as well. I don't know how advanced your periodontal problem is, and I think that would probably give me the answer to know what's in your better interest. I know that as a dentist, having been a dentist for a while and having made a countless number of dentures, it's always better to have as many teeth as you can. You know, you don't really have patients that really love their dentures. You have patients that pretty much tolerate them. You have patients that can either deal with them or can't deal with them. But even if you have a few teeth in your mouth, that way the denture can grab the teeth, you're going to get a better result. I know that in an upper denture, you know, you have something going over your palate, and you're having a nice chunk of plastic in your mouth, and not many people enjoy having that. You also have around 300 pounds of biting force. You have a big muscle here called a masseter, and you have a lot of biting forces with your jaw. Your masseter is supposed to be the strongest muscle in the body with 300 pounds of biting force. If you have your teeth removed and you have a denture, your biting forces go from about 300 pounds to about 30 pounds. It is unfortunate to go through the periodontal problem because it is something that we want to address, and we want you to keep your teeth as long as you can. But I also understand that it is expensive to go through the periodontal cleanings and do things like that. It's really, really tough. It is in your better interest to keep the teeth if you can keep the teeth. But I'd have to see the progression or how advanced your periodontal disease was to give you an answer on that. If you think that you can pull them out yourself, then and they're that, you know, it's that far advanced, you probably will be unfortunately better off getting rid of them. If you are going to get rid of them, I personally would recommend that you get some type of an implant retained denture. It's a lot more expensive, but your quality of life is, if you had a denture without the implants, especially on the lower. If you have all your teeth removed on your lower, the denture won't even stay in. If it does stay in, then it's not going to stay in for long. As soon as it fits, because your bone, when you remove your teeth, your bone's going to resorb over time. So even when your dentures fit, they're not going to fit in 1 year. And it's going to be a nonstop headache. And your general dentist knows that as well. It's just going to affect your quality of life, and so, you know, it's unfortunate you have that. But if you do want to remove them, or if you're just tired of dealing with it, I do encourage you to look into implant retained dentures. And I think you'll get a better result. And we'll just do the best we can with what we have to work with.
All right. Great advice. So, Sandy, thank you so much for calling this evening. Well, I tell you what, we are going to take a short break. When we come back, we'll give you the information of how you can contact Dr. Horwat at Bluegrass Endodontics. We have had a great time with you this evening, but we'll take a break and we'll give you that information right after this. So come on back with us. And you are watching Open Line. We're glad that you have joined us this evening. We really appreciate all the calls. Wanted to make sure that we gave you the information on Dr. Horwat's practice. It's Bluegrass Endodontics, and you can reach them at bluegrassendo.com. The number is 615-824-7546. Located in Hendersonville. They also have a practice in Mount Juliet, so plenty of opportunities for you to get there. And, of course, a lot of times I know it's going to the dentist and getting that recommendation to go see the endodontist.
From the News Channel 5 Network, this is Open Line.